I'm delighted to co-chair this hearing with you on this very important issue of dyslexia. It's important to both you and I, it's important to the Congress, and it's sure important to the nation. I would like to thank Senators Alexander, the chair, and the ranking member, Senator Murray, for allowing us to hold this hearing today and to focus on dyslexia and really the understanding of it and the intersection of scientific research and education. This is a very interesting hearing at many different levels. First of all, we're co-chairing. That in of itself is very different. And the fact that we see each other as really not a Democrat or a Republican, we see each other as advocates for children and children who need special attention, and then what type of special education do they need. The second thing is that within the realm of Congress and the prickly atmosphere we sometimes find each other, we would be regarded as an odd couple. The odd couple, because Senator Cassidy and I come from different parts of the country. We come from different political parties, and occasionally on our votes, even different political philosophies. But again, in this room, in this committee, we are focusing on the needs of children. And that doesn't know politics. It doesn't know the lines that separate us or divide us. So Senator Cassidy is a physician, I'm a social worker, so we bring those kinds of attitudes and skills to this table. We look forward to hearing from our witnesses, and you should know that this will be a hearing where we really want to engage in a conversation with you on how we can best help these children that are facing these challenges. This won't be a harass and a harangue hearing. This will be really an informational dialogue, and I look forward to doing this. I regard each and every one of you as experts at the table. Come from very esteemed academic centers of excellence: Yale, Georgetown, Hopkins, Kennedy, Krieger. But there are other great centers of learning, and they're called the streets and neighborhoods, where kids grow up, because as they face challenges, their education comes from the street. But the first teacher and the first learning center is in the home. And that's why it's so important that we hear from a parent who's actually lived these issues and tried to cope with the issues, as well as how to get the best plan and the best opportunity. So all of you are experts in different ways. We expect a lot from our teachers, and I would like to salute our teachers. As we work so hard on the elementary, secondary education and No Child Left Behind, and now our latest version of that, we believe that every problem could be solved if we had a highly qualified teacher in the classroom. Well, we need highly qualified teachers in the classroom. There's no doubt about it. But when a child walks into that classroom, the child brings a lot. They bring a lot from the home, their family history, their social situation, and so on. So we expect a lot of our teacher, but the teacher should begin to expect some things of the larger community. I support the school with children who are trying to do the famous individual education plans. I forget how all those acronyms come together. But the fact is this: you can have the best plan, but unless you can operationalize that plan, what does it mean? And it is because of the very nature of the unfunded mandate, where we only pay 10% of special education funding. And then we argue over Title II and how we can even provide additional training for our teachers. The school systems are hard-pressed to have that individual education plan and to be able to operationalize it. But today is not a day to talk about budgets. Today is a day to talk about children and science. But I do bring to your attention that special education is an unfunded federal mandate, and we need to come to grips with that. And we need to come to grips with it across party lines, because I think if there's one area that we could agree upon is that we should fund that and meet our obligation so that states and then local school systems could do what we told them to do. And I urge my colleagues to think about that as part of an action plan. But today is about dyslexia, a lifelong condition that affects the way the brain processes written and spoken language. It's considered the most important learning disability. I know that Senator Cassidy is going into a lot of the information and a lot of the data that I won't say again. The recent report from the National Center for Learning Disabilities highlights the many challenges our country faces when trying to meet the needs with dyslexia and other learning disabilities. These challenges include a lack of awareness and understanding among educators and even healthcare professionals, a lack of teacher training when they're in schools learning how to be teachers and then in the mentorship, and then a lack of scientifically based reading interventions and a lack of resources to accommodate it. So today, I really want to listen to the experts, those that are officially designated learning centers, but those that have been in the streets and neighborhoods and lived the life of being challenged by dyslexia, those who've been a mother trying to be on the phone, trying to be on a chat room, and trying to do everything that she could to make sure that her daughter had a fair shot at following her dreams and her passions. So I want to thank you for your insistent leadership and look forward to hearing this testimony.
I'll now defer to Senator Murphy to introduce Dr. Shaywitz.
Thank you very much. I'm eager to get to testimony as well. I'm going to have to step out to another hearing and come back, but I'm very excited to introduce the expert of experts at the end of the table, which is Dr. Sally Shaywitz from Yale University, where she is the Audrey Ratner Professor in Learning Development at the Yale School of Medicine. She's got a long list of titles, including the co-director of the Yale Center for Dyslexia and Creativity. She's one of the leading researchers in this field, and as a physician, her research focus really has been on neurobiology and epidemiology, providing a scientific basis for understanding dyslexia, and she's written more than 200 journal articles, chapters, and books on this topic. I know that she is a great source of counsel for both the chair of this hearing and myself, and I'm glad to have Dr. Shaywitz with us.
I'll introduce Mr. Baraka. Amir is an actor and author from New Orleans, struggled to read his whole life, didn't learn he was dyslexic till age 23 and incarcerated. In prison, he earned his GED, was empowered to influence youth who struggled the same way as he. I'm eager to hear how he has used his stardom, he's now an actor, to steer children off the path to incarceration. And I'll defer to you, Senator Mikulski, for Dr. Eden and Dr. Mahone.
Well, I'd like to introduce Dr. Guinevere Eden. She's considered to be a nationally recognized expert in dyslexia research, and one of the very first to use brain imaging and MRIs to better understand the neurological basis for dyslexia. She's been supported both by NIH and NSF, and currently directs the Center for the Study of Learning at Georgetown, and continuing to investigate while she is actively involved in teaching graduate students and really investigating all the sensory processing related to reading and how these may be different in individuals. She's going to bring a lot to us. We also have Dr. Mark Mahone, who is a Baltimore guy through and through, grew up in a neighborhood called Dundalk, which was just very close to the one where I grew up. He's a pediatric neuropsychologist, and he is at the esteemed Kennedy Krieger Institute in Baltimore. This is an institution internationally recognized and dedicated to improving the lives of those, particularly children, with brain and other challenges. What Dr. Mahone does is he provides clinical services for young kids with neurodevelopment disorders, works on the training of psychologists and educators and physicians on these issues, and really is an expert on involving the study of brain behaviors in children with or without these neurodevelopment disorders. He currently serves as the co-director for Center on Innovation and Leadership in Special Education, and he brings really great knowledge about what the children need, but what the systems that are supposed to help the children need to do. And I'm very proud to bring he and Dr. Eden to the committee's attention.